out. You know, it's one thing to have it. It's another thing to die. You know, when I first got involved, I was being told numbers that were much, much higher than the number that seems to be. And remember that people that have it, many people have it. I just spoke to 2 people. They had it. They never went to a doctor. They had it, absolutely had it, but they never went to a doctor. They never went to anything. They didn't report it. You have thousands and hundreds of thousands of cases like that. So you have to add that to the caseload also. And the people that actually die, that percentage is a much lower percentage than I ever thought. That's one of the reasons I say, look, we're going to beat this and we're going to get back to work. Yes, please.
Administration today, the DOJ announced charges against Nicolas Maduro for drug trafficking. They've designated him as a narco-terrorist. It's also expected that Venezuela is going to get hit really hard by the coronavirus. Does the administration see this as a weak point for the Maduro regime?
No, we don't look at a weak point. This is a serious problem for over 150 nations, the virus. I would say this, Maduro and Venezuela, we're watching it very closely. We'll see what happens. But that is correct. Those charges were made. Please.
You said a moment ago that you used the Defense Production Act on 2 minor occasions.
Yeah.
What were those occasions?
We will give you that notification. We'll let you know. Okay?
Can I follow up on John's question about the classifying for counties? A lot of these areas have not done testing yet. Is it safe to say that the current guidelines will be extended into next week? Will you wait to change those guidelines until you have the data yet left?
I want those guidelines to go even when we're open and fully operational. And frankly, much of the guidelines, like shaking hands, maybe people aren't going to be shaking hands anymore. You know, Tony had mentioned to me, Tony Fauci, the other day that I don't think he would be too upset with the concept of not shaking hands. He was saying that the flu would cut down, the regular flu would be cut down by quite a bit if we didn't do that, if we didn't shake hands. You know, the regular flu, of which, you know, you have a lot of deaths and a lot of problems with that too. So I think a lot of great things are going to, when we're open, just to finish, when we're open, as soon as we open, that doesn't mean you're going to stop with the guidelines. You'll still try and distance yourself, maybe not to the same extent because you have to lead a life. But I think the time is coming. How about one more question? Go ahead, in the back, please.
Thank you very much, Mr.
Go ahead,
President.
please.
I also have 2 questions because I'm asking on behalf of foreign press as well. So one domestic question, one international. Domestically, you just tweeted the other day saying that it's very important that we totally protect Asian Americans.
Yes, I do. Very important to me.
But still millions.
Very important to me. We have to protect our Asian Americans. It's a very important. That was a very important tweet to me because I didn't like things that I was hearing. Please go ahead.
Well, what's the concrete measure that you're taking to combat the hate crimes against Asians?
Well, I don't know. All I know is this: Asian Americans in our country are doing fantastically well. I'm very close to them, as you know, and they're doing fantastically well. And I think they appreciate the job we're doing. But I did want to put that statement out, the social media statement, because to me, Asian Americans are a great part of our country. Thank you all very much. We'll see you soon. Thank you.
I have 2 questions for you, Mr. President. On your guidance to the county by county, how does that work, Mr. President? Will people be able to go from county to county if it's high risk and low risk?
Well, good afternoon, everyone. The White House Coronavirus Task Force met today. We continue to move out on President Trump's directive to slow the spread with mitigation, to advance and expand testing across the country, and to work on the critical supplies that our healthcare workers in our nation needs. Today, the President convened the nation's governors, all of the states and territories, and reiterated to them that with FEMA in the lead, our approach is, our response to the coronavirus in this country is locally executed, healthcare workers, local public health officials. It is state managed, and it is federally supported. We took the opportunity to thank all of the governors across the country, our states and territories, for their incredible leadership and the partnership they've forged with this administration. We were able to confirm that 10 major disaster declarations have been issued, most recently to New Jersey, North Carolina, Florida, Texas, and Illinois. We spoke to them about the importance of the economic recovery legislation that will come before the House of Representatives, we believe, tomorrow midday. And we're grateful for their efforts in working for that unanimous bipartisan vote in the United States Senate last night. In addition to direct payments for American families, the average family of 4 will receive a direct payment of some $3,400. They'll also receive payroll report. Many of the small businesses, even those restaurants that you just spoke about, will now be able to keep people on the payroll for a period of months